My name is Michael Marletta. We are distributors in Malta for Bluem products. And it is an occasion for us to present a small, short slideshow for Bluem products. We thank our participants for joining us, and we hope that you all enjoy what we have to say to you, and hopefully you will learn much more about Bluem products. As I have already said, Bluem products are revolutionary products for oral care, and whose basis is the slow release of oxygen. And we also know that oxygen has a key role in the healing of the healing processes. So Bluem is actually a company which is based in the Netherlands and Brazil. And our mission is to elevate health and well-being through oral care. It all started with, in the early 90s, with Dr. Peter Bluem, who came up with his active oxygen formula. And together with a young and ambitious team of individuals in the Netherlands, they adopted his vision, and this is where Bluem started to flourish. It is the oxygen molecule saturation which penetrates deeper into the biofilm that makes it more effective than chlorhexidine. The graph below clearly shows the activity of the Bluem zone, where patients have severe oral problems. And Bluem products are already sold in over than 50 other countries worldwide. And Bluem has invested heavily in the research and collaboration with universities and professional bodies. The commercial production started actually in 2010. And to date, Bluem products have achieved worldwide award recognitions. We also participate in several well-known international events, which probably you have also visited us on our stands. We are proud to have so many dedicated employees with us, and the list continues to grow. And these are a few of the faces which we know, and actually it's very nice to see the new faces coming into the company. As Albert Einstein once said, there are only two ways to live your life. One is as though nothing is a miracle. The other is though everything is a miracle. And at Bluem, we believe that life is though everything is a miracle. We want to elevate health and well-being by leveling up oral health, and we make it happen by making revolutionary oral health products. And this is a short video of as a promotional video. Thank you. So the last, we've come to the end of this short presentation. We have 2 QR codes there. If you would like to become part of our community on Facebook, you have the first QR code there. And for those who would like to acquire some samples, you can scan the QR code on the bottom. And you will have a list of all the distributors which you can choose for your country. I'd like to thank you for your patience, and we look forward to seeing you participating actively with Bluem products. Thank you.
Thank you, Michael. Let me now share my screen. I think that now we're good. All right. Okay, so good evening. I'm Dr. Minas Leventis. I would like, first of all, to thank Michael and Caroline in Malta for their excellent work. They are good friends and amazing professionals. And also, of course, I would like to thank the Bluem family and all the colleagues who are attending today. For the next 45 minutes, I will try to show to you how I'm using the Bluem oxygen products in my everyday practice. And that's me. I have a PhD and a Master of Sciences in Oral Surgery from the University of Athens in Greece. I'm also a diplomate of the International Congress of Oral Implantologists. The last 8 years, I work in London. So my private practice is in London, in the UK. And also I'm a clinical fellow and researcher back at my home country in Athens at the University of Athens. The last 15 years, we have done extensive research. We have published many papers. Everything is focused on bone grafting, tissue engineering, and implantology. And today, I want to show to you some very interesting topics about oxygen, why, when, and how I'm using Bluem and oxygen products in my everyday cases. And I will try to give you some ideas, some tips, some guidelines that can help you to improve your results in your everyday cases. So we know from the medical literature that oxygen is very important. It has a crucial role in wound healing, and it is involved in many different processes of the hard and soft tissue healing. It's essential when we have any type of wound in the body, we need oxygen because the cells increase their metabolic activity, so there is a high oxygen demand. And then oxygen will be very important to promote wound healing by stimulating several processes. And what does it do? It is improving the neovascularization. Oxygen is accelerating and enhancing the production of collagen. It is important for epithelialization, for killing bacteria. This is also very important. And also oxygen has a role in removing any necrotic tissue. On the other hand, if a tissue is trying to heal and there's not enough oxygen, we have hypoxia, and this might result in pain. We can have a pain, we can have slow healing, we can have a poor healing, and we can have lots of complications. So it's very important to have oxygen for the hard and soft tissue healing. Whatever applies in the body, everywhere in the body, and we know this from medicine, the same principles apply for the oral, the hard and soft tissues. It's exactly the same principles of healing. And there is just published a very nice narrative review about the role of oxygen in angiogenesis and oral wound healing. It's just published, you can find it, it's open access, and you can read this nice review about how oxygen can help the healing of the oral hard and soft tissues. There are many different clinical and experimental studies. We have lots of literature now about oxygen and about the Bluem products, how we can use them and how they are involved in the healing of the oral soft and hard tissues. And just to tell you a few things how the Bluem products work, they have some active ingredients. They contain sodium perborate, that it is releasing the active oxygen. What is important to note is that we have a constant, slow release of a small amount of oxygen in a controlled manner for about 10 to 20 minutes when we apply the Bluem products. So it's important to say that it's not an acute release of a high amount of oxygen, like it happens with peroxide. It's a slow release for a few minutes. And this is also very important because it's very safe and give us very good results. The products also contain sodium perborate, honey, xylitol, methyl salicylate, and lactoferrin, which are some important ingredients that have an anti-inflammatory action. And also they promote the activity of osteoblasts. And also they help the products to penetrate into the soft tissues. And we know that the oxygen molecules, when we apply the Bluem products, they can go deep around 4 millimeters in the soft tissues and give us this beneficial effect. There's a range of products that we can use, and this is very helpful. There are mouthwashes, oral gels, foam, toothpaste. So according to any clinical scenario and what the patient needs, we can find a Bluem product that fits the specific needs. Now, when do we use such products? We can use them before we do any kind of treatment. I use them intraoperatively during my surgeries, immediately post-op after my surgeries, and then after the healing period, we can use such oxygen-releasing products in the long term to maintain our treatment outcomes. So that's very important. It's not dentistry, it's not just, most of the times, just a single procedure. It's perioperative processes of linked procedures, different procedures. That's why you will see that we need oxygen during all the stages to give us the best results. So let's say what we can do when we prepare the patient for any kind of surgery or dental treatment. We can use such products many days before the surgery, like a oxygen toothpaste or a Bluem mouthwash, and this will help to control the bacteria in the mouth before we do our intervention. And just before the surgery, we can use as a mouthwash to clean the mouth. And most importantly, nowadays, we can see, and there are some very nice papers to read, that active oxygen can be very effective against the coronavirus infections. So it's a very good idea and mandatory before we do any dental treatment to use such a mouthwash. I'm going to show you several different clinical cases, different clinical scenarios, and I will explain to you my concepts and my approaches. First of all, during my surgeries, during my treatments, how I use those products and why. First of all, during extractions, I like all the time to use something like the Bluem gel or the mouthwash or the foam. I will show you how and why. We have to remove teeth. Most of the times there is a problem. Teeth are associated with some kind of chronic or acute infection. We have lots of bacteria, and we need to clean the extraction sites and remove as many bacteria as possible and control this bacterial load. So what I do is I need to remove the tooth and try always to do an atraumatic extraction. I try not to be harmful to the surrounding soft and hard tissues. This is very important. And when I have removed the tooth and mechanically using my curettes, I try to clean the bone very well. And then, as you can see here on the pictures, I apply using a syringe, I apply the Bluem gel inside the socket, and I can leave it there for 3 to 5 minutes. And then I rinse it. How I can rinse it, like we see here, I rinse it with sterile saline, or if I have the Bluem mouthwash, I can use the Bluem mouthwash to rinse any surgical site. And you can see here immediately how those materials, how they release oxygen. You can see all the bubbles. And this is how the gel or the mouthwash or here the foam works when I apply them in extraction sites. So the reason for doing this is, first of all, to control the bacteria, and then the oxygen can remove any dead cells and any debris from the site. So we know from surgery, it's not only important to do a good extraction, a minimally invasive extraction, but also we need to clean everything and to try to disinfect the surgical site intraoperatively. So a very good idea, instead of using just a sterile saline or a chlorhexidine product, for me is to use the Bluem products to do that. And why we need to try to avoid chlorhexidine. We know chlorhexidine. I was using chlorhexidine for many years. Chlorhexidine, we know that it is very effective to killing bacteria. It's like a bomb. It kills all the bacteria. And this can be good, but at the same time, this has many side effects. And we know from the literature that the use of chlorhexidine is associated with problems. We can have a parotid gland swelling, pigmentation of the oral soft tissues and the teeth. It's very important that we can have some allergic reactions using chlorhexidine, so we have to be very careful or maybe avoid using chlorhexidine directly into open wounds. It can alter the taste, the sensation. We can have some burning sensation as a complication. If we use lots of chlorhexidine for a long time, we can see even mucosal ulceration or erosions. And even if the patient uses lots of chlorhexidine, we can have some alterations regarding the sensation, some anesthetic effects, or even paresthesia. So we can see that chlorhexidine might be really effective, but because it has all these problems and these side effects, we cannot use it for a long time. We cannot use it for many days and just a few times. On the contrary, in my extractions, in my surgical cases, I can use oxygen as many times and for as long as I need, because there are no side effects like the side effects associated with chlorhexidine. When I remove semi-impacted or impacted wisdom teeth, like this case here, most of the times we have some periodontal problems. We have some local infection. So we need a good healing. It's not just to remove the tooth. We need to do a very good surgery, a clean surgery, a minimally invasive extraction. Like in this case here, we need everything to be clean, to remove as less bone as needed, and to cut the tooth into many pieces to remove it easily. But this is not enough. We need to clean the area, remove all the inflammation, all the soft tissues. And what can help us is the oxygen. That's why when the bone is clean, after I use my mechanical instruments, I take a syringe with Bluem gel and I go directly into the bone defect. I apply the Bluem gel and I leave it there for around 5 minutes. After that, I rinse it. And as you can see, we need to use a high quality suturing material to close our wound. And again, this is essential. Now we need to help the soft tissue here to heal nicely. We don't need any postoperative infection. We don't need any wound dehiscence. we need to avoid any dry socket. And to do this, what we need to do is we need to control in this area the bacteria every day during the healing phase. What I'm doing, I'm not giving any chlorhexidine products anymore to my patients. Instead, when I finish the surgery, again, I apply a small amount of Bluem gel directly on the post-extraction area. And then, as you can see here, I place my gauze and I ask the patient to bite on this gel with the gauze for at least half an hour. That's very important. And then I give a tube of the gel to the patient and I ask the patient to apply locally there at home the gel 2-3 times a day during the first week at least. This is essential, and this is essential why? Because in this way we'll have good healing, we'll have less inflammation locally, and the controlling of the bacteria is the most important factor to lower the risk of a dry socket. If we do all this, we can help the patient and we can help the body to give us a good healing, meaning that we'll have a nice area here. We'll try to avoid any deep pocketing as a postoperative complication, and we will avoid any postoperative infections and other issues. Not just during extractions, sometimes we need to do apicectomies, we need to remove cysts, radicular cysts, like in this case where I needed to remove this radicular cyst, a periapical cyst. At the same time, I did the kind of retrograde filling. So the first step was to remove the old filling material from the apex of my tooth. And now that everything is prepared and clean, what we need to do again, we need to control the bacteria, kill as many bacteria as possible in this area, and also start helping the healing to accelerate and give us a better result. So that's my protocol. I don't leave it like that. Before doing my grafting, my GBR, I take my gel again, I fill the whole cavity, the whole area with the gel, and I leave it there for 5 minutes. And these are the important benefits, the reason why I'm doing this in every surgery I'm practicing, because it will have an anti-inflammatory effect. It will help to take away the necrotic tissue. It will kill many bacteria. And these ingredients of the Bluem products, they will start by the first minute, helping improving the new blood vessel creation, the synthesis of new collagen. So we'll have a better granulation tissue in there, then a better collagen formation, and that is going to lead into better bone production, better epithelialization on top, and a better outcome. Here we can see how I finished my surgery. So in this case, I did this flap. That was the design of my surgery. And you can see that we try to keep everything clean. We need to use, again, I have to mention this, fine monofilament, high quality sutures. This will help the healing and will lead us to less formation of scars. And I'm not leaving it like that. I need to help it. So I use my gel immediately post-op. And as I told you before, I will give also the gel to the patient to use it at home every day. What will happen is that doing this, we will get less postoperative infections, less chances the wound to open, to have a dehiscence, and at the end, it's going to give us a lower risk for scar formation. If we try to be careful and try to follow such protocols, you see, everything is important. Most of the times we'll get a very nice result. Like in this case, this is just after 6 weeks, and this is after 7 months. You can see that we hardly can see the scar. We have an excellent healing. Everything heals nicely. And also the soft tissue has an excellent response. And this is because of our surgery, what we did surgically, and because we helped the wound here to heal in the best way. Because the oxygen helped the stitches to be clean, control the bacteria and enter this area here and help the collagen and the epithelium to heal in a much better way. All these steps are, in my opinion, are very important, can really improve the healing. Another reason is we need to keep the stitches clean. And the problem with surgery in general and with oral surgery is that we have accumulation of bacteria on the surface of our suturing materials. We know that silk is very biocompatible, and this is a reason why we have lots of bacteria accumulating on silk. But it's not just silk. Even if we use, like in this case, a monofilament, we can use after a few days or immediately after a few hours that the bacteria, the plaque accumulates on the surface of the sutures and also on the surface here of my healing abutment. And is this important? This is really important because this bacteria here can give us an infection. If we read the medical surgical literature, we'll see that the accumulation of bacteria on the surface of the stitches is the #1 factor for postoperative infections. So if this will get infected, I might have a problem with my implant, I might have a problem with my underlying bone graft, I might have a problem with wound dehiscence, pain, inflammation, slow and poor healing. So what we need to do, we need to keep this clean and we need to control the bacteria that they try to accumulate on the surface of the stitches. That's why I encourage all the colleagues to use a gel like the Bluem gel and avoid using anything with chlorhexidine, because the gel is going to help the stitches to stay clean and to limit the amount of bacteria that they will accumulate on the surface of the stitches. And again, this means less infections, better healing, less wound dehiscence probability, and less scar formation. Another case like this one, I placed my implants, I did my bone grafting. Here I used a 5-0 monofilament suturing material. And I need now to be sure that this area will heal in the best way. Again, I will take my gel. I can find now preloaded into syringes, or I can take syringes and fill them with the gel. And I will not use chlorhexidine. Why? Because it will kill all the bacteria in the mouth. It is toxic. It has high cellular toxicity. We can see from the in vitro and clinical studies that it can restrain cell proliferation and the synthesis of collagen. So it doesn't help the wound healing, chlorhexidine, on the contrary, and also we can not use it for a long period of time. On the other hand, we have only benefits by using oxygen. So that's why I prefer oxygen. Immediately post-op, I will cover all this area with my oxygen gel, and I will give it also to my patient to use it at home. A very nice idea is to use it like this, because many times I prefer to give to my patients a partial denture with a palatal flange, like here. So all the pressure goes to the palate and not on the ridge. And I instruct the patient to use the gel like this to fill this area of the denture with the gel and then fit it in the mouth. So the gel will be on the stitches, on the wound area, and the gel will penetrate the lines here, and it will help the granulation tissue. It will accelerate the synthesis of collagen, and it will improve the epithelialization. So that's how I finish the surgery. That's what I ask the patient to do every day at home. This is after a few days. You can see that everything is very clean, but because of tension, it's common to have some kind of opening. So we see here the margins of the wound. We can see clearly the fibrin network and the granulation tissue. And this is now a very sensitive area, and we want this soft tissue here to be free of bacteria, to have no inflammation, and to speed up the soft tissue healing. If now we are going to get some kind of infection, we might have a big problem, and the infection can lead to a loss of the underlying graft and can give us many problems. In order to be safe, we need to control all this. So again, the oxygen will help me, on one hand, to control the bacteria, on the other hand, to improve the healing of the area. So the area in the next weeks will heal nicely and will have a very nice result, as we can see here. The big benefit is that we can use this every day. So because it has no side effects, the patient can take the gel or the foam. Here we can see the Bluem gel immediately post-op. This is after a week when I remove the stitches. And now the patient can continue using the gel or the foam or the mouthwash. The result is the same. We have this nice oxygen penetrating the lines of the wound, accelerating the healing, and keeping under control the bacteria. So as I was telling you, a very big benefit is that the patient can use it every day, as many times as the patient wants, and for as long as needed to help and get a very good healing. There are no side effects, no problem, so we can use the oxygen every day for as many days as needed. It's very important. Also, we can use these benefits when we are doing implants. And this is a very, very big topic. There are many things to consider. What we need to know is that dental implants are a complex, a unique system, that it's not just an implant, it's a system comprising of human hardened soft tissues, mechanical components, and oral bacteria, the biofilm, and all these parameters are linked in synergy. We have a synergy, and it's very important because if one of such parameters is not good, has a problem, then we'll get problems to the whole system of our implant. What is important to know, which are the critical elements of this anatomical and functional system, as this very nice paper from Mattheos and his co-workers describe in detail. What we need the proper 3D implant positioning. We need a good implant abutment interface. It's very important. The hard tissues, the soft tissues, what quality and quantity we have of the surrounding hard and soft tissues. Very important is to know, understand, and design the anatomy of the emergence and the cervical profile. The choice of materials for our abutments and restorations. And last but not least, crucial, very important, the biofilm. It's always present. Whatever we are doing is in the presence of oral bacteria, and we need to keep this under control. So let's see some good ideas, what we can do. We must avoid seeing or doing cases like this anymore. Just looking at these pictures, you can see that all the critical elements of what we try to design here are not present. Everything looks wrong. The position of the implant is wrong. There are no soft tissues, no good quality of soft tissues. Apparently, we can understand that there are no good hard tissues buccally. You can see already that we have bacteria here. It will be very difficult to clean it, and there is literally no good soft tissue profile. We have to learn, we have to understand, and to find out how important, and at the same time, it's quite easy for all of us to get not the previous result, but to have results like this for all our cases every day. And this is not important only because we have a good aesthetic outcome. Also, biologically thinking, it's crucial, it's essential to develop a proper emergence and cervical profile around our implant restorations. Why this is important, why we need to consider and we need to learn how to reconstruct the soft tissues in this way. It's important from a mechanical and a biological way, because when we get the proper profile, when we have a cervical profile like this one, it means that the contour of the restoration will be located in this area, you see, very far away from the platform. And this is exactly where we are going to have the plaque control zone. So all the bacteria will be accumulated here in this red line area, which is this area. It is the contour of our restoration. So it's very easy, it's very accessible for the patient with everyday easy and normal hygiene procedures to keep it clean, to remove the biofilm, to remove the bacteria from this area. So the restoration will be clean, will have no accumulation of bacteria in the long term, and this will help us to have long-term health and stability. On the contrary, we need to understand that if we don't have a good, proper 3D implant placement, positioning, if we don't have a good emergence profile, if we don't have a good cervical profile, good soft tissues around our implants, if the design of the prosthesis is poor, this is going to lead in a very bad control of bacteria, and this, in most of the cases, will give us very big problems with perimplantitis. So what can we do? Simply, we can control the bacteria, and a very easy way to do this easily and properly is by designing the soft tissues around our implants. These are some very nice, hot, and important topics we are working on right now. So we can use anatomical customized healing abutments like this abutment here. And this can help us to establish a condition, a proper emergence and cervical profile. It can help us reconstruct the soft tissues in a very easy way. It can simplify the procedures. It can improve the aesthetics. But as I mentioned and pointed out, it can help us to have favorable biological response and a mechanical, proper and sound final prosthesis. In all the stages, again, we need to control the bacteria and we need to help the soft tissue healing. Again, as you are going to see, the Bluem products and especially the gel can help me a lot to disinfect the components, to keep under control the biofilm, and to enhance the healing of the soft tissues. And the cervical system in my hands is the best tool in order not to use stock healing abutments. Such abutments are not enough for me to do what I need to do to recreate my soft tissue profile. The cervical system can help me design customized healing abutments, and for each individual case, I can have the perfect healing abutment that will give me the best results. We have published several papers. You can find them, or I can send you all the papers to read in detail what I mean and what I try to explain to you. So using oxygen, using proper tools like the cervical system in synergy with oxygen products, we can have for our everyday cases tomorrow, the next case we'll see, for every one of us, it's not something that needs very high skill. We just need to learn and understand what we need to do to go from this initial point where we have an everyday case that we want from A to go to Z and get in a predictable way an excellent result like this one. The first step to accomplish this is to place the implant at the correct 3D positioning. This is number one. If we cannot place the implant at the correct position, then we're going to get only problems during the next steps. And a very easy way to do this, there are many ways, of course. We can have a surgical guide, a surgical stent. We can go absolutely freehand, which is not the best idea, especially if we are dealing with molar areas in the posterior mandible or maxilla. It's not very easy freehand to find the best positioning. A very easy way to do this and to position our implant is to use the guide tools, the guide system here from the cervical system. And it has some very nice metallic tabs, which first of all can help us to measure the space. Like in this case, I use this 10 millimeter tab, circular tab. That means that here we have 10 millimeters. And also it has a hole in the middle. And through this hole, which lies exactly in the middle of the ridge, I can use my pilot drill to position the perfect site for the initial osteotomy. So first step is to get the right positioning according to the mesiodistal and lingual buccal position. So we have to go exactly in the middle. And then we need to place our implant at the proper depth. It's also important to know that we have at least 4 millimeters from the platform of the implant to the zenith of the soft tissues. So it's a 3D positioning. Firstly, I have to say again and again, the most important thing is to position the implant at the correct 3D positioning. Now that the implant is in a very good position and it has some good stability, what I can do now, my next step during the this initial surgery will be to start reconstructing and expanding and conditioning the soft tissues. How we can do this? Using this system, we can take a temporary PICC or titanium abutment. Here is a PICC abutment. We can fit it onto the implant. We can mark here the buccal aspect. And then we go to the cervical system. And as you can see, this silicone mold has many different positions with different anatomies of emergence and cervical profile. So we choose for each individual case, we choose which size and which anatomy of customized abutment will be the ideal. So we take the PICC abutment and we place it at the area here at the side of the mold of the cervical, which will give me the desirable anatomy of abutment. In this case, I use the molar small central position. So what we do, we just fit the abutment and we fill it with composite. And in just a few minutes, we have ready a customized anatomical healing abutment like this. So we used the cervical system, a PICC or titanium temporary abutment from the implant manufacturer, and some composite to just in a few minutes prepare a customized abutment. Now we have to polish it, and we need some Bluem gel because we need to control the bacteria in this very sensitive area. And we know from the literature that every time we connect and we disconnect and we fit back a healing abutment, a temporary prosthesis, always we have some bacteria getting in there. We have some detachment of the epithelium, and this creates some inflammation. So we always get much better results when we use, when I use my Bluem products into this implant abutment interface whenever I remove, I fit back a component. So that's what I'm doing. And you can see here how I finish my surgery. I just fit the anatomical abutment onto my implant. I torque it and I cover here the access hole. And gently, the only thing I need to do is to reposition the flap here on the contour of my abutment. And that's how I finish the surgery. Now I need everything to be clean. I need to control the bacteria on my stitches. I need to control the bacteria on the soft tissues. And I need to accelerate the healing, because here we'll have these wound lines. We have some secondary intention healing. And what is my aim now is, on one hand, to keep it clean, to control the bacteria, and at the same time, to accelerate and optimize the soft tissue healing. The only way to do this is to keep it clean and to give the gel and the oxygen products to the patient, to apply them every day, many times every day, during the whole healing period. So you see, we disinfect the area, we optimize and we accelerate the healing. We do nothing else. That's the only thing we need to do. And you can see here that in one step, in one surgery, we placed our implant, we fabricated in a few minutes, and we fitted a unique, customized anatomical healing abutment. We use our Bluem products, that's my protocol. And after 3 months, everything is ready. The implant is integrated, and the emergence profile, the cervical profile, the topography of the soft tissues now is ready. There's nothing else to do. No more surgery, no more injections, no more suturing, no more procedures. We have dealt with everything in one step. We have created everything in one go. And now you can see how simple it is. You can see the steps of such easy, straightforward protocols. First of all, again, the correct positioning with the cervical system. It's very easy to use the cervical tools to position the implant exactly in the middle of the ridge of the edentulous space. And then we can take the system and help us select which anatomy and size of custom abutment we need to do, and chairside to fabricate it, fit it, and finish our surgery and have an excellent result. This is very important. Why we need customized anatomical abutments? Because these abutments will give us the ideal, proper, biologically sound emergence profile. And what do we mean by that? We need that the soft tissue needs to form a correct soft tissue barrier around the implant prosthesis. And this means that it will need a zone of connective tissue deep here. And this zone must be around 1.5 millimeter. Then we need to recreate and condition a proper junctional epithelium zone that will be at least 1.5 millimeter. And again, I have to point out that the plaque control area has to be located far away from the platform. It has to be located at the periphery, here at the cervical profile. And this is where we want the bacteria to accumulate, so it will be easy to remove them. Going back to our case, everything is ready. Very simply, we need to take an impression. It's a good idea also with the cervical system to fabricate, again with composite, a duplicate impression post, so we can register and send all this anatomy, the subgingival anatomy, to the lab. And the lab now, very easy for the lab to use the best technology to follow the topography and the anatomy of the soft tissues that we created, and using CAD/CAM technology to make a beautiful, milled, customized abutment and a very nice zirconia crown. So we follow the anatomy, and also we have here titanium. Here we have polished zirconia. So it's the anatomy, it's the topography, it's the selection of the materials that will give us the best, not just aesthetical, but also biologically sound result. So you can see here the final crown, the anatomy of the emergence profile of the final crown. And we see now, using such tools, that the final crown just follows the duplicate post and follows the anatomy of the customized anatomical healer that we created. So there's no guesswork from the lab. We do all the work. We create the hard tissues, the implant placement, and on top, we regenerate and we condition and we reconstruct the soft tissue topography to get an excellent result for all our cases. I want to share with you another case to highlight again the importance of controlling the bacteria, the importance of improving the soft tissue healing, and the importance of reconstructing the soft tissues. Here I did an immediate implant placement. I removed this, it was a broken premolar. Immediately I installed my implant, and chair side, immediately after grafting the area around my implant, I fabricated and I fitted a customized healing abutment. So you see now that we can create chair side any size and any anatomy of customizable healing abutment. In this case, we had the cracked premolar. That's the tooth that I removed. And you can see that this specific tooth at the cervical profile has this specific anatomy. This is the cervical anatomy of the tooth. And by creating the proper customized healing abutment, we can recreate, we can mimic, we can follow the anatomy of the tooth that we just removed. I fit my abutment, and again, I need to optimize the soft tissue healing. I don't need now any problems. I don't need any infection. I don't need any poor healing, slow healing. I don't need any surprises. I just want this to heal perfectly, quickly, in the best way. So again, that's my protocol. I want to control the bacteria, get rid of the bacteria, enhance the healing. And this is what I'm doing again in every case. It's a key element. It's a part of my work, because I'm sure now that the nice surgery that I spend my effort to do, now this oxygen gel will help me to have the best result postoperatively. I give the gel to the patient, and I tell the patient, take the gel and rub it on this area gently every day, 3, 4, 5 times a day for as long as needed. After 10 days, you can see that we achieve what we want to achieve. Everything is clean. You can see how clean is the suture here. And we can notice that we have a very healthy and fast secondary intention healing of the soft tissues in this area and in this area. Now we continue doing the same. So I continue giving the gel to my patient and asking the patient to continue using the gel and a Bluem toothpaste with a very soft brush, because now we can start brushing and we can continue keeping the bacteria under control and keeping everything clean. If we manage to do this, after 3 months, we will get a very nice result, meaning we have a perfect healing. You can see now the topography and the quality of the soft tissues, how they are attached to the clean surface of the composite here of our customized abutment. And this is the best thing we can see. Everything is done. the only thing we have to do now after 3 months is to remove the customized healing abutment, and we see what a beautiful emergence profile, what a beautiful anatomy, and what quality of soft tissues we have around our implant. So that's the ideal. We'll be able to make a very nice crown and will stay there healthy in the long term for a long, long time. Apart from implants, there are many other ways how I use these products every day. And we can see now how we can use them in the long term to keep everything clean and to keep the good results that we achieved for our patients. Many of the patients now, they use night guards. Many people now grind their teeth at night, so they have night guards. A very nice idea is to use the foam. I give the foam to my patients and I ask them to use the foam before they fit in their mouth the night guard. And when in the morning they remove the night guard, they have to brush it and they fill it with the foam, so they leave it aside with the foam inside. This is going to disinfect the night guards and keep everything clean for a long, long time. The same when we have orthodontic aligners, when we have retainers. A very nice idea is to use the foam. It's the best tool we have to keep all these aligners, all these retainers absolutely clean and free of bacteria. You will see when you will try giving the foam to your patients, you will see that when you will see the patient again for any checkup, they will be very happy and they will ask you where they can find more of these products, because not only they feel much better when they wear the aligners, but also the aligners are very, very clean. Now, what else? We have interdental brushes like this one here, or like these plastic ones that we like more around the implants. And it's not just enough to use the brush. What I like to do is I instruct the patient to use a small amount of the gel and then to use the interdental brush. This is a case, this is an implant that I did 5 years ago. And this is the goal now. We need to maintain in the long term these beautiful results. And to do this, apart from having done a very good implant placement and restoration, we need to keep it clean and we need to keep under control the bacteria. These products are excellent, and they are excellent not just because they are effective, but also because they have no side effects at all. So the patient can use them any day, as many times a day, and for every day. This is very important. They can use the gel, they can use the foam. You can see here, you can use the foam like a mouthwash, just spray it inside the mouth, and all this oxygen is killing the bacteria. And at the same time, if we have any areas of inflammation in the mouth, it will help the epithelium to heal better and really, really faster. So these are some important benefits why I'm not using anymore any chlorhexidine products. And on the other hand, I'm very happy and satisfied with oxygen. It works instantly, directly on the treatment area, like I showed to you how I use the gel or the foam during my procedures. It is optimizing and accelerating the healing, especially the healing of the soft tissues. It has a very good antibacterial activity, but at the same time, it's not harmful for the normal flora of the mouth. The oxygen can remove any necrotic tissues. The ingredients of the Bluem products also, they can help with the postoperative pain, and they can limit a bit the inflammation. Very easy to apply them. We have a big range of products, and very importantly, there are no side effects at all, no cytotoxicity, no problem with the taste, no pigmentation on the teeth, no staining, no resistance, and no disturbance of the normal flora. So as a conclusion, I would like to say that it's many parameters when we do any dental or surgical procedure, but also we have to take the extra mile. It's not just the surgery. We have to provide to our patient whatever we can do to help him and to help the healing in the best way. So in my opinion, oxygen is one of the key components for any successful treatment in my everyday practice. Before any treatment, during the treatment, immediately post-op, and always in the long term to maintain our beautiful outcomes. So I would like to thank you for your patience. I hope that it was interesting and helpful. This is my email. This is my Facebook page. Please feel free to contact me if you have any questions or if you need any assistance. Thank you very much.
So thank you very much, Minas, for your presentation. It was very interesting, and hopefully our participants would have gained so much more information. I would like to conclude by saying that for those who are interested in the Bluem gel to purchase it, they could easily contact the distributor within their country. And we presently have an offer of those purchasing 5 Bluem gel. They get an extra 5 for free. So it would be really interesting to see if the participants will be interested in this unique offer.
So from my side, thank you very much. Thanks everyone for organizing this event and everyone for participating. Thank you, Michael.
Thank you.
Thank you, Bluem. Thank you very much.
Thank you very much. Good evening.
Good evening.